Good afternoon, everyone, and welcome to today's SOAR webinar on integrating SOAR in HUD CoC homeless response systems. My name is Pam Hine, Senior Project Associate at the SAMHSA SOAR TA Center, and I'll be moderating today's webinar. So before we begin, just a few preliminary items to review. So a quick disclaimer, this webinar is supported by CMHS, SAMHSA, and DHHS. The contents of this presentation do not necessarily reflect the views or policies of these agencies. The training should not be considered substitutes for individualized care and treatment decisions. So a few webinar instructions. So the slides and other materials and the presenter bios may all be found in today's chat area. They're also available at the SOARworks website. And also, it can be found in the reminder emails that you received about this webinar. And you'll also receive an email after the webinar with a link to the materials as well. So now is a good time to download those materials if you'd like. A recording will be available within about a week on the SOAR website and then later on YouTube on the SAMHSA page. We will reserve time at the end for some questions, so please submit those questions using the Q&A feature. All participant lines will be muted and the chat feature is disabled. There will be an evaluation and your browser will redirect you to a survey following the webinar. Also, if you're interested in receiving a certificate for joining this webinar, you'll do that after you complete and submit the evaluation. So that's something new for us. So we're really excited to make certificates of joining available to you. As you can see, we have ASL interpretation today by Pamela and Stacy, and also closed captioning by Brenda. So we're really glad that we can provide these accessibility features for you. So to view, click the live transcript and select show subtitle. For ASL interpretation, you can pin the interpreter video by selecting the three dots in the upper right corner of the video. So right now, I'm pleased to introduce Doreen Gross, who's the PATH Program Coordinator and our SOAR core with the Division of State and Community Systems Development at SAMHSA, who will give our welcome today. Doreen?
Thank you, Pam. A warm welcome to all of you joining us today. On behalf of the Substance Abuse and Mental Health Services Administration, also known as SAMHSA, I welcome you all to this SOAR webinar titled SOAR and HUD Continuum of Care, Integration for Homeless Response System Improvement. So the U.S. Housing and Urban Development, also known as HUD, CoC programs are pivotal to addressing homelessness and housing instability across communities and state. The HUD CoC program requires a community-wide commitment to ending homelessness, which includes promoting access to and utilization of mainstream programs such as SOAR. Today, you will hear from states which have integrated SOAR within their CoC systems using various strategies. We'll also share a new SAMHSA resource about SOAR and CoC integration strategies. So I would like to welcome and thank our panelists for your willingness to share your expertise on this important topic. So now I will turn it back over to Pam.
Thanks, Doreen, for your support. So our learning objective. So it's our hope that by the end of this webinar, you'll have a better understanding of the importance of SOAR to CoC system performance, and you'll learn about various strategies CoCs around the country have utilized their CoCs to integrate SOAR and apply some of their strategies to put into practice within your own state or local CoC system. So to reach those objectives, we are so thrilled to have on our panel Sumitra Polkato, who's a project associate here at the TA Center, Amanda Stadler, who's in Missouri, a state PATH contact or state lead. So she wears a lot of hats. Hope Rogers, the Director of System Change at the Texas Homeless Network, which is the balance of state CoC in Texas. Then also Omar Martinez, which is the lead agency in Houston. So we're really thrilled to have Omar join us. And then from one of the agencies which they coordinate is Latanya Flusis, who's a SOAR case manager with Search Homeless Services in Houston, along with Frank, who is a SOAR beneficiary who utilized SOAR services at Search. So we're really glad to have his voice here today to kind of round things up and to really share how SOAR Benefits has really assisted him in reaching his housing goals. So we'll have plenty of time for Q&A, but right now we want to kick things off with Sumitra, who's going to talk a little bit about COC and SOAR.
Great. Thank you so much, Pam. And good afternoon, everybody. Thank you so much for joining us. We really appreciate your presence here, especially during this really, really busy NELFO season. So I am really excited to be kicking off our webinar today and really kind of talking about this important critical piece of homeless response systems, really thinking about income growth and thinking about how SOAR can be a tool that COCs can really consider using in their homeless response system to address this measure. So before we get to all of our experts who will be talking on the call and providing really practical examples, I would just like to kind of take this time just to do a little bit of level setting, just to make sure we all understand the role of HUD continuums of care and to make sure that we understand SOAR and how that fits within. So generally speaking, when we think about a homeless response system, right, when we think back to our communities and we just kind of think about, circumstance of homelessness and how we attempt to address that, right? It is a really complex public and social issue that really requires multiple solutions. And within that requires multiple community partners from different levels and from different systems, right? And so even though a lot of the resources to address homelessness come from, federal and state and local governments, the actual response to addressing it and working directly with people happens locally. It happens in our local communities. It happens with the people living locally in our community that, really experience this and work with this and collaborate, with our neighbors experiencing homelessness every single day. So when we talk about homeless response system over the course of this webinar, it's really referring to the myriad of organizations and entities within an area, whether that be a state or a group of counties or a group of cities or whatnot, that serve individuals and families whom are experiencing homelessness. And as I mentioned, a problem that is, this complex, requires multiple community partners. And so when we think about homeless response system, the type of providers can include nonprofit organizations, housing authorities, federal and local, city and state governments, faith-based organizations, shelter providers, homeless coalitions, right? Everyone who really kind of has, a stake in helping to prevent and end homelessness. And again, I would make the argument that because this is, looking at our own local communities and, living and working, right, and playing in those communities, I would really say that the entire community, anyone in that has a stake, in preventing and ending homelessness. So in terms of still kind of thinking about local homeless response systems, we're going to be talking a lot throughout this webinar about HUD continuums of care. And the easiest way to kind of think of a COC is that they are kind of the central nucleus of local homeless response, right? So when we are thinking about, the myriad of different kind of community partners and systems involved with, addressing homelessness, right? Your local and or state continuum of care is kind of the central organizing body that is responsible and tasked with by HUD for just kind of coordinating that local community's policies, strategies, and activities to prevent and end homelessness. So really kind of serving to coordinate that for that local community. And so really kind of there are many goals or functions or duties or activities of a HUD continuum of care, which you'll hear about on the webinar. But some of their main duties are just to improve coordination and integration with mainstream resources and other programs that are targeted towards people experiencing homelessness, improving data collection and performance measurement, and really kind of tailoring each community's homeless response systems based on their particular strengths and their particular challenges in being able to assist individuals and families experiencing homelessness within that community. What's really kind of central for us to keep in the back of our mind is, as we go throughout this webinar and talk more about how SOAR can be important and a critical tool in homeless response, is being mindful of system performance measures. And so when HUD established continuums of care, they identified various system performance measures that they expect local continuums of care to meet, in terms of their local homeless response. And they designed these system performance measures to help COCs be able to assess their current efforts and how they are addressing homelessness, right? And again, as we're talking about, complex problems require complex solutions, right? And so, really kind of looking at how these system performance measures help COCs to be able to evaluate where they are performing well, right? Where their system design is performing well and meeting the goals and being able to move people efficiently to address their needs, but also where are some of the areas in which there could be more thought behind it, or that COCs can think about how they can meet that measure more effectively or more quickly, right? Or just kind of like really just using that as a measure to evaluate where they are with their homeless response systems and identifying where they're doing really well and identifying where they can also still improve or just continue, because we can always continue to improve. So the specific performance measure we're going to be really kind of thinking about and looking at in this webinar is looking at system performance measure number 4. And this focuses on employment and income growth and looking at how a local community's continuum of care is assisting the people that are, moving through their systems with being able to increase their income. So everyone here, on this webinar today, I really kind of encourage you to take a second and pause and think about your local communities, think about the systems or agencies that you work in or have worked in. Think about the individuals that you've assisted or that you see or that walk through your doors every day seeking help, that we aim to put our efforts towards to help, right, to prevent and end homelessness. And I encourage you to stop and think for a second about if you had to pick like what were the top 2 barriers, right, for people getting housed. I would almost guarantee that one of your top 2 answers would be either zero or lack of sustainable income. Guarantee. And just kind of thinking back on, the work that I've kind of done here at the TA Center with various local COCs in the states that I serve, oftentimes a lot of the conversations that we hear reflect back on housing cost burden, right? And looking at how that has been a primary cause or contributing factor to a person's risk of homelessness, right? Looking at, the increasing cost of housing in our local communities and looking at how oftentimes the, individuals that have zero income or have short-term types of income, that being in that kind of socioeconomic situation has really, really, really proven difficult for individuals to be able to either obtain housing and or maintain their housing, right? And so when, we are thinking about why it's important for COCs or local homeless response systems to prioritize or think about effective ways to increase income growth, there are a wide-ranging positive impacts for prioritizing this or for helping individuals to increase their income or connect to more stable long-term income, right? Again, we've already talked about it. If we're looking at it, from an individual level, right? Of course, increasing income is always going to help no matter what someone's recovery goal is, but also to, of course, to help them be able to obtain affordable housing, to be able to connect them to, health insurance benefits, right? Be able to hopefully increase access to people to be more included in their communities, right? Or to save for work or vocational goals, right? Lots of impact in terms of the individual level, but also too, when we look at agencies and communities and looking at connecting people to long-term stable income can really assist people with, looking at how that assists communities by bringing federal dollars back into that local community, or looking at how healthcare providers can really kind of recuperate the cost of uncompensated care, right? And then just kind of even looking more from a systems level, as I know many of you are likely from local continuums of care here, but again, looking at those system performance measures and not solely just looking at the system performance measure of income and growth, but looking at all the other system performance measures and really think to yourself, does increasing someone's income ultimately help improve those other system performance measures? And if we were all in a room together, I think that probably almost all of us would probably collectively shake our head yes, right? That having that income as a base makes it easier for those other measures to be achieved. Or from the individual level, make it easier for someone to achieve whatever kind of a recovery goals they may have. And so what I really kind of hope for you to take away from this webinar today is really kind of looking at how SOAR, which stands for SSI, SSDI, Outreach, Access, and Recovery, can potentially be a tool that fits into local homeless response systems to help increase income and, on the back end, of course, help meet that system performance measure for local continuums of care. And just in case there's anyone on the call today that isn't as familiar with SOAR, it stands for SSI, SSDI, Outreach, Access, and Recovery. And what it is it is a model in which a helper would be trained to be able to assist individuals experiencing homelessness to apply for disability benefits. So a SOAR application isn't necessarily a separate set of forms in your traditional disability application forms. SOAR is more so referring to the process in which a helper is putting together a complete information. So including the forms, including relevant medical evidence, including information that helps to show how severely limited someone's functioning is, to help provide a more mainstream, more effective, quicker process for applying for disabilities, okay? And so if somebody was, helping someone going through your local homeless response system and wanted to help them apply for benefits, SOAR is the best practice that they might use to be able to do that. As you may have garnered, SOAR is targeted towards individuals who are experiencing homelessness or at risk of imminent homelessness and who have a serious mental health condition, co-occurring substance use disorder, or other physical disability. It's a national model. It's been sponsored by SAMHSA in collaboration with the Social Security Administration since 2005. And it is, you will find SOAR within all 50 states and Washington, D.C. How it's implemented may look differently state by state, but it is national and found in all 50 states. So let's talk a little bit in terms of the benefit of possibly including or utilizing SOAR as a tool in homeless response, because we've talked a little bit already about why it's important to increase income, right? But what might be the benefit of utilizing a tool like SOAR, right? Of having SOAR work being done in your local homeless responses. So not necessarily just training, but having the actual work being done and kind of looking at how that could possibly fit within your homeless response system. First and foremost, SOAR works across the lifespan. So there's training for, both youth and children, transition age adults, all the way up to adulthood. So it is a model that can be implemented across the lifespan, depending on age, implemented with diverse populations and within complex systems. When you look at the various systems involved within your local homeless response system, whether it is hospital and healthcare settings, whether it's legal settings such as prisons and jails, whether it's looking at the foster care system, right? Whether it is looking at homeless shelters, SOAR is a tool that benefits all of those populations and can fit into all of the work already being done in those systems. There are people in those systems already well-intended and good-natured trying to do that work already. And looking at how SOAR could potentially help them do that work more effectively. Efficiency, of course, right? The goal is to help improve the health and quality of life of people experiencing chronic homelessness, and utilizing a model such as SOAR, right, that puts together a complete application and helps to save time during the benefits acquisition process helps to improve the efficiency of people applying for benefits. Looking at how, the outcomes of getting approved help to increase equity and health equity among people experiencing homelessness. And looking, of course, at how access to benefits promotes long-term financial stability, right? Again, I'm sure many of the individuals that we're assisting or attempting to assist in our systems, even if they might have like some sort of short-term, income coming in, but really thinking about how do we connect people to long-term financial stability? How do we have creative solutions to connect people to long-term financial stability? An important one that I always like to highlight is that disability beneficiaries, so that meaning someone who's been approved and is receiving benefits, can still pursue employment and or other vocational goals to maximize income, right? So if we're thinking about creative solutions to increase income in our homeless response systems, right? I encourage you all to be myth busters and not buy into the myth that, or the stigma or the fear that somebody who is applying for or receiving disability benefits, that is just a label or something they're stuck with for life, or that's the end all be all. That's absolutely not true. Income is a base from which someone can grow. It is just a base. It is the safety net. It is a tool. And that it doesn't have to be a self-fulfilling prophecy for someone that they can only just solely be a disability beneficiary. And also to SOAR, lastly, just the SOAR values the benefit that comes from involving individuals with lived expertise, and that people with lived and living expertise can fit anywhere into the SOAR process. And I know that there are many COCs out there that are trying to meaningfully engage and integrate people with lived experience into the work that you do, or into COC functions and activities, looking at how there's a place literally in every single intercept of the SOAR model in which peers fit into and make better. And if that wasn't enough for you, I also want to point out that SOAR works. So what you see listed here on this slide are our SOAR outcomes. So if you're looking on the right side, these are our national cumulative outcomes. So numbers from since we've been tracking in 2007 to present. And as you could see, nationwide, we're at a 65% approval rating on disability applications that were submitted using the SOAR model. And as you can see, that 65% is not on a small number of applications, on approximately 59,000 applications, 65% approval rating. On the left side are our yearly outcomes. So from July 1st, 2023 to June 30th, 2024, very similarly, a 65% approval rating nationwide. So, compare that 65% approval rating to the current 29% approval rating for people applying for disability benefits in general. These are just some of the financial outcomes, looking at Medicaid reimbursement, general assistance reimbursements, retroactive back payments, and just examples of how communities benefit. And before, again, I turn it over to before I turn it back over to Pam, I do encourage you all to check out our new issue brief document called SOAR Integration and Continuums of Care. It provides it really expands on a lot of the topics we're talking about today. It really highlights different kind of strategies that continuums of care from across the country have engaged in, or created, or developed, or incorporated into their continuums of care related to SOAR. So looking at coordinated entry, looking at steering committees or work groups, looking at incorporating SOAR into project applications, funding, things of that nature. We will, of course, highlight some of these on our webinar today, but I really encourage you all to check out that document for more fully fledged information on that. And with that, I'm going to turn it back over to Pam.
Thanks so much, Sumitra, for setting the stage today, and also providing a great overview of COCs and also SOAR, because we know on this call today we have many folks that know about their COCs, but not SOAR. We've had some great questions about how do I become SOAR trained and things of that nature. So we'll provide links and resources on how to do that. So we are, and vice versa, there are folks who are SOAR trained, but may not know how to connect to their local COCs. So I think it's really great that you have a better understanding. And that will lead us to our first panelist, Amanda, who not only is the state PATH contact, she's also the SOAR state lead, and she knows intimately how to integrate SOAR into their COC system. And she'll share a bit now about how she goes ahead and does that. Amanda?
Yeah, thanks, Pam. And thanks everyone for joining us today. As Pam said, I'm with the Missouri Department of Mental Health, and I am the state SOAR lead. And just for a little bit of context as well, before I was in this position, I was COC lead agency staff as well. And so I am going to share about success that our state has seen with implementing a local SOAR steering committee. And so I'm going to go over kind of the who and where of our state, and Springfield, Missouri, which is the community and continuum of care where this has been implemented, just to kind of level set my presentation, and then go over kind of the what of the success that we've seen there. So that's a little bit at looking back at what we have accomplished, and then looking forward to what our future goals are. And then my last section will be a how. So that will be some takeaways of how we have implemented different strategies to have success with the steering committee. Next slide. And again, Yep, this one's good. So just again, to kind of level set, for Missouri, we have 8 different continuums of care in our state, which you can see here. 7 of those are kind of localized to specific communities or geographies within our state. And then the remaining COC is a balance of state COC, which covers 101 of our more rural counties in Missouri. And so Springfield, which hosts the Ozarks Alliance to End Homelessness as their continuum of care, is the steering committee that I'll be spotlighting today, and they are located in the southwest part of our state. Next slide. And then again, this is just a kind of snapshot of our point in time count numbers from 2024, just to give some context and numbers for who is experiencing homelessness within our state. So across our state, we have approximately 4,780 total individuals that are experiencing homelessness. Again, this is according to our 2024 point in time counts, and approximately 50% of those are unsheltered, are in emergency shelter. 30% are unsheltered. This middle graph kind of does a breakdown of our population by continuum of care. So you can see that the Springfield continuum of care has approximately 13% of our total population. And then within Springfield, approximately 60% of individuals are sheltered and the remaining 40% are unsheltered. So that is a quick edit to my slide, that the color coding is reversed for the data points there. And the next slide. So going into kind of the what of really how our steering committee has started from and then accomplished to this point, is really this community was kind of starting from zero with SOAR implementation. So within the last 12 to 18 months is when all of these accomplishments have kind of started and come to fruition. And some of the accomplishments that we have seen are having local leads. So prior to really kind of starting this SOAR focus, this community did not have a SOAR local lead. It had very, very few even case managers that were trained and active in SOAR, which of course also means that our data was kind of starting at zero as well, because there weren't individuals that were entering outcomes into OAT. And so once we had a local lead, we really identified that improving communication with our Social Security field office was a key starting point. And so we have accomplished that. We have a local process for submitting SOAR applications. We've really improved communication with our representative at the Social Security field office in this community. There is only one field office here. And we've also, we're even able to have an in-person training with our Social Security representative and a DDS representative. So that was something we were really excited about, to have that in-person training with those representatives, again, to just kind of build that process and improve communication with the Social Security field office. SOAR has also been identified as a standing agenda item at continuum of care meetings. So there is a designated committee within this continuum of care that meets monthly, that is discussing SOAR, and again, just having regular conversations and developing strategies around SOAR. And the other kind of key accomplishment that we have had over this calendar year is having quarterly community SOAR meetings. So we initially identified some key gaps and then scheduled these technical assistance sessions around those. But kind of what we've seen as the meetings have progressed is they've really kind of just turned into SOAR 101 sessions, which has really been fine, because it's still been a consistent place to have conversations about SOAR, answer questions, and just really provide support to partners and case managers that are trained in SOAR and case managers or individuals that are interested in becoming trained in SOAR. Next slide. And so then looking ahead, really all of these strategies tie back to building sustainability for SOAR within this community and just further integrating SOAR kind of into the system level work of the continuum of care. So a couple of key areas that this continuum of care wants to focus on is increasing partnerships with healthcare partners overall. So building support for doing SOAR applications, and again, just really integrating SOAR more with that system of care as well. And then of course, since we really were kind of starting at zero, is increasing the number of SOAR trained providers, which we've already seen that over this year, but we definitely want to continue to increase that. And then really tying all of that work back to OAT to make sure that we are using that system to have a good baseline of data, not only to measure our progress, but also to target different training opportunities as well. Next slide. So the how. So I think really our key strategy here was just continuing to have conversations. So I know I sometimes just felt like a broken record because I was continually bringing up SOAR and having conversations with different partners. And I think all of those kind of conversations and continual strategies were really, well, I had 4 listed. And then as I listened to Sumitra's presentation, I added a few more. But they really all go back to having conversations about SOAR. So that involved doing presentations to the continuum of care membership and leadership just about SOAR, about the outcomes, about how the model does work, and how it could be implemented within this local continuum of care, and really just continually advocating for SOAR. Also participating in continuum of care meetings, again, to bring up SOAR. And that's one of the key ways that this process started within the Ozarks Alliance to End Homelessness was through their strategic planning process, where they identified income as a key gap that they wanted to address. And there was enough local interest that we could really tie SOAR to that outcome as a strategy to address income. Also using data. And I think if you don't have local data for your community, that could be using state data, or that could even be using national data, really just to support the conversation around SOAR and support the fact that the model does work. The other key kind of tactic or strategy that we used was applying for the leadership academies and doing that intentionally. So really making sure that someone that would be a good fit and have the capacity to take on that SOAR leadership component is applying for the SOAR leadership academies and using those resources and then bringing them back to the local community. And then really our last kind of key strategy was really leaning on our liaison with the SOAR TA Center to support all of this work. So they were really an invaluable resource through this process, just supporting us with getting data, with coming up with training topics, and again, with helping facilitate that conversation with our local Social Security field office. So I think, again, really just to summarize our how is, I think it really does come back to having conversations. And I really want to echo something that Sumitra said about highlighting that the connection between income stability and housing stability, and really making that connection for continuums of care, that this really is a tool that they can use to supplement the work that they are already doing. And that concludes my presentation, and I look forward to the question and answer session later, and I'll turn it back to Pam.
Thank you, Amanda, so much. You kind of, really highlight how easy it is to include SOAR in your local continuum of care through a work group or being put on the agenda. So hopefully more folks have a better understanding on how to do that themselves. And you've hit on all of the C's that SOAR discusses: having those conversations, collaborations, coordination, and community partners. That's what it's all about. So thanks for sharing how you were able to integrate SOAR within your local COC. Now we're going to throw things over to Hope Rogers, who's with the Texas Balance of State COC, and how you do it at the state level. Hope.
Yeah, thanks so much for having me. Hi, I'm Hope Rogers. I use she, her pronouns. I'm the Director of Systems Change at Texas Homeless Network. I am excited to talk to you all today about how Texas Homeless Network has integrated SOAR into our COC program funding competition. And then as a result, how SOAR has been integrated into our performance management strategies. So I am going to jump right in and tell you a little bit about Texas Homeless Network. So we are an Austin, Texas-based nonprofit organization that serves as the Continuum of Care Collaborative Applicant and Homelessness Management Information Homelessness Management Information System lead agency to the Texas Balance of State Continuum of Care. In addition to our continuum of care-wide work, we also engage in some statewide work around ending homelessness, particularly around advocacy and policy and legislative work. And then we also host the largest conference on ending homelessness in the state of Texas. So a little bit about the Texas Balance of State Continuum of Care in terms of composition. There's truly not another continuum of care that is comparable in terms of the geography and population that we serve. So we cover 215 of Texas's 254 counties, which equates to about 85% of the counties in Texas and 87% of the state's landmass. And within that landmass is 13 million residents, or about 44% of the state's population. In terms of funding, our COC brings in $16.9 million in annual continuum of care funding, and then another $4.9 million in supplemental continuum of care funding. And this doesn't, of course, include other funding sources like the Emergency Solutions Grant and the supportive services for veterans and their families through the VA, but just a snapshot of continuum of care funds in the Texas Balance of State COC. So this is a map of the COCs in the state of Texas. We are one of 11 COCs, and we cover all of the counties in orange, so quite a large service area. Because of our size, we face some unique challenges relative to other COCs that require us to be really thoughtful and really strategic about the work that we're doing, particularly around SOAR. Some of the challenges that we see are varying levels of sophistication in terms of local crisis response systems throughout our vast geography. Our geography is primarily rural counties, but also a mix of suburban and some urban counties as well. So there's varying levels of differences in terms of resources that are available and stakeholders that are available, as well as local buy-in that can really drive this work forward. And because our COC is so geographically vast, we rely really heavily on coordination with local crisis response systems in our continuum of care to drive change forward. So we operationalize that through coordinating really closely with local homeless coalitions, coordinated entry regions, and federally funded housing projects throughout our region. And unlike most COCs, our staff are not physically in the communities that we're serving on a day-to-day basis. And that requires us to make some pretty difficult decisions on a day-to-day basis in terms of where we're focusing our time and effort. So a little background about what SOAR has looked like in the Texas Balance of State Continuum of Care. So as a COC, we have had a longstanding commitment to the use of SOAR and integration of SOAR within local housing crisis response systems throughout our geography. But have historically had some challenges in making meaningful progress for a lot of different reasons. One, the capacity of our staff at the COC level, but also the capacity of our local providers throughout our geography. Additionally, there's not any one dedicated funding source that will support SOAR work. And so those challenges have made it historically difficult to gain traction in terms of increasing SOAR coverage in the Texas Balance of State Continuum of Care. And then in 2022, HUD released a special funding package called the it's quite a mouthful, the CoC Supplemental Notice of Funding Opportunity to Address Unsheltered and Rural Homelessness, which is also called the Supplemental NOFO or the SNOFO. But this was a special funding opportunity that HUD made available in 2022 alongside their annual funding process to address rural and unsheltered homelessness nationally. And with this special funding opportunity came some special requirements for collaborative applicants. So for folks who aren't familiar, continuum of care collaborative applicants are tasked with carrying out and facilitating a competitive funding process for continuum of care funds on an annual basis. And continuum of care funds are HUD's single largest investment in ending homelessness nationally. So it's a really vital funding source for many communities and many providers. I think I'm going to move us on to this slide. A vital funding source for many providers that are working to address homelessness locally. As I was saying, in 2022, HUD released a special package of funding that came with some special requirements. One of those requirements was for collaborative applicants to develop and submit a COC-wide plan to serve individuals and families experiencing homelessness with severe service needs. And it was up to each continuum of care to determine what should be included in this plan and what the final plan will cover. And the purpose of the plan was to guide the implementation and ongoing evaluation of projects funded under the special funding opportunity. So as a COC, we utilized a participatory process to develop our COC-wide plan in response to the special funding opportunity. So during this funding competition, we hosted a number of listening sessions where we invited stakeholders throughout our region to come and share their input and feedback and insight on what should be included in this plan. We really intentionally included folks with lived experience to be at the table as well. And in addition to those kind of live feedback and listening sessions, also offered a number of opportunities for folks to submit written feedback through different survey opportunities and different email opportunities. And as a result, our final plan really represented the diverse needs and the unique voices of stakeholders throughout our region, which I think was really critical to gaining buy-in around this process. So this plan identified 14 key priority areas for this funding opportunity, one of which I included on screen here, which was to employ staff whose primary function is to assist individuals with their SSI and SSDI applications through the SOAR process. So what that looked like during the competition is that we required all applicants in order to be considered for funding to demonstrate alignment with one or more priorities. And the more priorities that an applicant could demonstrate alignment with, the more points that they would receive in connection to their project application. So we incentivized alignment with the priorities through scoring. So essentially, and for folks that may not be familiar, the Continuum of Care program funding is highly competitive, and the supplemental notice of funding to address rural and unsheltered homelessness was even more competitive. So every point really mattered during this process. And as a result, we saw a number of folks who were willing to demonstrate a commitment to utilization of SOAR in connection to their project. So in terms of what we looked for to demonstrate alignment, at the time of application, we essentially just asked to confirm the intent to use SOAR on an ongoing basis. And if a project indicated that they intended to use SOAR, we also required them to request specific funding within their project application to fund that position, meaning they couldn't tack SOAR onto an existing case manager position or have it as part of another case manager position. We really wanted it to be the primary focus of that person's role, because if you've been a housing case manager before, you know how often you are navigating different crises with a client, with landlords. And so it can be really hard to prioritize both a caseload of folks who are in rapid rehousing and permanent supportive housing and help keep them in their housing and do SOAR work on top of that. So in response to this specific funding opportunity, we were really looking for folks to request that specific funding through the supportive services line of the Continuum of Care program. We recommended 11 projects through the supplemental notice of funding opportunity. Unfortunately, we only received one project that was awarded, but that one project was funded for $4.9 million rapid rehousing program that will bring Continuum of Care funds to 23 counties in the Texas Panhandle that have never before had access to these funds. In addition, that funding is also bringing online funding to support up to 13 SOAR workers in that region as well. So we're really seeing some significant progress through that initial supplemental funding opportunity. And since we, as a COC and as well as our stakeholders, put so much work into the development of our COC-wide plan, excuse me, we as a COC decided to carry forward the priorities of our COC plan into our annual competition processes on an annual basis. So what that looked like was starting in 2023, we again pulled out all of the priorities that were developed in response to the supplemental funding opportunity and required all applicants moving forward to demonstrate alignment with those priorities on an annual basis to be considered for funding. Excuse me. Again, we continue to prioritize these through scoring. So again, the more priorities that an applicant can demonstrate alignment with at the time of application, the more likely they are to be funded because the more points that they would receive through that process. So I wanted to switch gears a little bit and talk about how we as a COC view SOAR as a tool for performance management in two different ways. So COCs have a responsibility to monitor and evaluate the performance of Continuum of Care and Emergency Solutions Grant funded projects and take action against poor performers. So we see SOAR as a tool to improve performance outcomes for funded projects that are struggling with performance. But we also see SOAR as a tool for projects or communities that aren't yet funded or don't have diverse streams of funding as a strategy for increasing their competitiveness to receive additional funds in the future. I think Samitra and Amanda both kind of touched on the ways that SOAR can be used as a tool to increase not only system performance measures, but also as a tool to increase housing retention and maintenance rates. But we also see SOAR as a tool of fostering local working relationships and community collaboration. So with the Continuum of Care program in particular, HUD has an emphasis on a community-wide commitment to address homelessness. SOAR is the perfect opportunity to build those local working relationships in your community and demonstrate a community-wide commitment to ending homelessness that can be leveraged in connection to a housing-focused program application. Additionally, we see SOAR as a tool to reduce the rental subsidy and supportive services cost of ongoing participants. So when a participant doesn't have any income and then goes through the SOAR process and starts receiving income, that means that person can now start paying a portion of their rent towards their overall portion of rent on a monthly basis. And that in turn reduces the overhead at the agency level and creates space to serve other folks through additional supportive services or additional rental assistance. So it's also a tool to increase your overall budget capacity by having more folks contribute to their rent on an ongoing basis. So typically what we find is that when a project is struggling with performance, it's generally the result of a data quality issue. So the first step that we take is improving data quality to see if, after improving data quality, if the project is still struggling to demonstrate improved outcomes with income growth. As a COC, we place a pretty heavy emphasis on income growth for participants, particularly in rapid rehousing projects, but also in permanent supportive housing projects as well. It's kind of the key point of engaging in a project is that they'll be able to exit and sustain themselves long term, and folks can't do that unless they have a reliable source of income to utilize. So once data quality is cleaned up, if we determine that a project is still struggling with income growth, we then look at how SOAR can be integrated into the project as a tool to increase income growth amongst participants, and as a result, improve the overall performance of a project and the overall competitiveness of a community to continue to receive funds through federal sources and expand the diversity of funding sources that they're receiving on an ongoing basis. So I also wanted to talk a little bit about what ongoing support looks like specific to SOAR in the Texas Balance of State Continuum of Care. So
I hope you cut out a little bit. Your audio froze. I'm going to see if we can get you back. I think Hope was finishing her presentation. We'll get back to your last slide, maybe at the end of the other presentation. So we'll stay in Texas. We'll move along to Omar, who will talk about what he's doing in Houston. Omar?
Hey everyone, can you guys hear me?
Yes, we can hear you well.
Awesome, thank you. Thanks for having me here. My name is Omar Martinez. I'm the manager of the Homeless Response System Planning and Implementation at the Coalition for the Homeless in Houston. We service 3 counties, Harris, Fort Bend, and Montgomery. And so today I'm going to talk to you about how we put into practice SOAR in our local community. So I really like and want to echo something that SAMHSA said earlier, how funding derives from federal, state, and local dollars, but it really is the community that comes together and implements a plan that will help individuals reach sustainability in their lives. And so one of the great things that my COC has done is meeting clients where they're at when it comes to access to housing, by following the housing first model. But in addition to that, understanding that housing is not enough to keep individuals out from sleeping out in the streets. So one thing that has been implemented in our coordinated entry system is incorporating an income assessment, determining very basic information on what project or which type of support a client needs. This is really important because you really determine early on where to meet your client at. And so coming together as a community, we devised 3 programs that really emphasize what clients in permanent supportive housing or rapid rehousing need. So after a series of questions in our assessment, that then determines whether the client has a disability, is able or unable to work, at what capacity they're able to work, and if they're interested in participating in a particular program. So the 3 programs during the time that SOAR started were SOAR, supported employment, which is funded SOAR is funded through federal dollars. Our supported employment program was funded as a mix between our county and city dollars. And then our public workforce system referral has no funding whatsoever. If it is strictly based off an MOU between us and our public workforce system. And so again, coming together as a community to determine how to best support our clients is really what's driving the work here in Houston to keep people housed. And so what it looks like as far as each particular program, SOAR, again, is we help identify those that have disabilities and have no regular income, and potentially maybe tapping into other benefits or in need of other benefits that would typically coincide with SOAR. This particular program does help individuals apply for SSI or SSDI. And of course, we are also making connections beyond just the submitting the claim. We are also helping with some other mental health supports and medical care that could potentially benefit the client long-term. Our supported employment program, known as Career and Recovery Income Support, also has, it essentially meets the client where they're at when it comes to their disability or having a history of not being employed over time. And so what this particular program does is it provides intensive work support services, intensive case management, oftentimes connecting individuals to sober coaches, and in addition, being a supplement to SOAR for those individuals that applied for SSI or SSDI that qualified but are still able to work, can get a referral to Career and Recovery's program and work part-time. And then for those that were denied or are going through the appeal process or just simply waiting to hear back from Social Security Administration, a referral will be able to help them at least find a job that suits their ability to work. And then lastly, for those individuals that have no disability that would not qualify for SOAR, SSI, or SSDI, or have not enough documentation to be able to prove that they would be approved for a claim, this is your traditional workforce development supports. With this in itself, we have a connection, again, no funding whatsoever. And so this really does help kind of spread the wealth when it comes to Houston and being able to meet people where they're at and helping them connect to the income needs that Samitra was mentioning earlier. All right, so we've gone through a little bit of rebranding. This is our new logo for those of you that are familiar with our older logo, sorry. And so I wanted to really dive deep into what we did with this particular program with SOAR. And so for this program, we partnered with 2 medical and 1 case management provider. The 2 medical providers also offered case management services, but in total, essentially, it was 5 different projects that we were managing. So Avenue 360 and Healthcare for the Homeless offered medical services and case management once the client was ready to move and phase out of the navigation piece, which I'll talk about in just a second. And then Search, which we have, I believe, LaTanya on the call from Search as a case manager for this organization, strictly providing case management services. Our goal, of course, was to help individuals that were unable to work at SGA level due to a mental health and or physical disability. The key piece for this in itself was that these individuals also needed to be enrolled in housing, whether it's rapid rehousing, permanent supportive housing, or emergency housing voucher. And this was really important because as you saw in the very beginning, when it came to our assessment, when this program started, there were a lot of clients that were coming in post-COVID or even during COVID, facing hardships that they've never thought that they would face, and that was housing insecurity. So we had a lot of individuals calling our intake line for an assessment that were not eligible for any type of housing intervention services. That becomes very challenging over time because you need that individual to have some kind of additional support other than just SOAR in order for that client to be successful. And the ones that we found to be the most successful were the ones that were in housing because we were able to identify key pieces of information that housing case managers could help us with, such as phone numbers, finding out the whereabouts of a client, some of the services that they may have tapped into in order for us to help with the claim, such as medical providers, prescriptions, and really just following up as well. I'm sure all of you can attest that following up with individuals that are experiencing hardships can be very challenging. And so just having that added support really helped out when getting a hold of clients for appointments, submitting documentation, and going through with some of the appointments that were scheduled for them. So the key differences between SOAR navigation and SOAR case management are that SOAR navigation offered medical care that the client may need because they weren't connected to a medical provider already. This in one helped the client, again, just tap into medical care, be able to address some of those underlying health concerns that were just gone under the radar for years. And so with this medical care, also allowed for medical practitioners, nurse practitioners, and doctors to be able to start establishing medical history, develop and produce diagnoses for these clients. And because all of it was in-house, all of it was funded under one larger grant, there wasn't much of a struggle trying to get doctors to agree to sign off on particular documents or to attest that a client was experiencing a particular disability or was connected to specific medications or other services to signify that the individual was unable to work at SGA level. They were also very helpful in being able to sign off on MSRs. I know that's something that is very challenging for other continuum of cares and other SOAR programs, is just trying to advocate for the client and trying to convince medical providers to sign off on very crucial documents. So that navigation piece was really a saving grace. So in that in itself, then once the client was ready after navigation, they then phased into SOAR case management, where the SOAR claim was submitted, and those SOAR case managers would provide the follow-up to the field office, DDS, entering data in OAT, and of course, following up on any appeal and pretty much acting as the representative throughout the entire process. Some things that I don't mention in here that were really crucial for our particular program was, of course, the collaboration and coordination aside from just the 3 agencies that we work with. It could not have been done without other connections. And of course, SOAR TA and Sumitra did a really great job in helping us just understand SOAR much better, be able to produce more successful applications, and really just kind of be like a landline for us whenever we ran into any bumps on the road. In addition to our program that really helped us succeed and kind of keep things coordinated was work groups, as some of my colleagues mentioned earlier. So we also had work groups, but because we were specifically funding these agencies and we wanted to make sure that they were successful, our meetings were held on a monthly basis. It is intense to meet on a monthly basis and have these discussions, and oftentimes not really see the fruits of your labor right away, because applications take a really long time just to hear back on some kind of decision or some kind of movement. So the monthly calls were also a tool and a time for us to be able to address any concerns that were happening with the field office, with any other entity that we were dealing with. One of the very important things that our work group also had was the help of our local SSA. We were very, very fortunate to have a director that was, I believe, a deputy director at SSA and understood some of the challenges that kind of come in with communicating with SSA and maintaining those relationships, and even just establishing them from the very beginning. And so because she came in with that background in that history, she knew to implement SOAR navigation and SOAR case management, but to also involve our local SSA field office representatives and staff members. Some things that came out of this were, of course, having SSA actually join our, at times, monthly calls, which is very hard to do. And on top of that, we also were able to develop other initiatives such as virtual calls. So some of the success stories that kind of came about this particular program are ones that shared all throughout, but in particular for this one, there's an individual that was 60 years old, had mental health traumas, and was really deep in the weeds when it comes to homelessness. But after 4 months of intensive coordination, not just with the SOAR caseworker and all the entities that follow with that, but also the housing case manager, this client was able and approved for SSI benefits. And this really helps the individual long-term to be able to support themselves beyond just housing, but to be able to provide some of the supports that our housing providers cannot, such as medications and things of that nature. And when you go back and look at through our slides, you'll see kind of like the flow for the individuals that were interested in SOAR, but they did not have any medical history, and those that did have medical histories and diagnoses. So if you go back and look at that and have any questions, feel free to reach out to me and I will be happy to assist. Thank you so much, Pam.
Thank you. And these slides are available to everyone as a resource. And thank you for sharing that success story. We're going to stay with Search in Houston, one of the programs that you support. And now we're going to hear from Latanya Lafusis, who is a SOAR case manager. So we're going to give her time to turn her camera on, and also Frank, who is a SOAR beneficiary through Search. So I'm going to throw it to you for a quick chat about being involved with SOAR. Take it away, Latanya and Frank.
Good afternoon. My name is Latanya Flusis. I'm a SOAR case manager with with Search Homeless Services. This is my now friend, Mr. Frank. Mr. Frank was on my caseload. We went through the process together. Ms. Frank, you want to tell them a little bit about your story?
Well, to start, I was doing that lost value.
Maybe we get Frank a little bit closer to the microphone so we can hear him a little bit better.
Okay.
After 5 years, I come grass. Like, start having health problems. I didn't know that I was a candidate for stroke on that part. Contacted me.
I am so sorry, Frank. We are still having audio problems. If at all possible, to get as close as you can to the microphone.
Hello, can you hear me now?
Is that
Oh,
better?
yeah. Yes, much better.
Okay.
Yes, ma'am. Do I need to start over?
Yeah, please.
Yes, I had experienced 5 years. I had lost. Came home, got a job, and I was working. At some point while I was working, I couldn't keep up with the job, so I ended up losing the job, and I started to cut some grass one day, and I couldn't make steps, and I like to cut grass, so went to the hospital and found out I was a candidate for a stroke, heart attack, because I had triple digit blood pressure, but I had no medication. I had no means to get medication. I didn't know how to get medication. So from losing my job, I became homeless. I went and spoke to Miss Lucy, search. She sat down with me and told me she could contact me. She said I could help you, but you have to help me. I'll work with you. But you need medication. I went to the doctor and they told me I was having a stroke, heart attack. This being real, I was experienced the last 5 to 7 years in like real bad, and I've been exclusive. I was homeless and hopeless, and she gave me hope, and now I have. There was no way I could have done all the things she done. I didn't know how to contact a medical provider. I didn't know nothing. I'm 54 years old. I never been sick. I always worked. For her to reach out to help me, and she said she would. She kept up with it, and I just be out in the streets, homeless, nowhere to go when it's cold, no warm water when it's raining. And somebody asks you to take these steps, and they can help you. I'm here today to say I'm truly helped. I'm truly blessed. Like I have a home. I have hope. I have a lot of things. If I have my medication, I got my blood pressure. It was triple digits, 189 to 102 or 3 at the bottom. Today it's 115 with the proper medication. And I didn't know how to get my disability. I didn't know anything from Miss Luce. Miss Luce and the company here, they helped me. They helped me a lot with my life. It changed my life. I have contact with my kids now, my daughters. There was a time when I didn't have no contact with nobody because I was home. But now things in place in my life. I have clean clothes. I got great hygiene. And I got a smile on my face today.
What would you like the community to know about going through the SOAR program, the SOAR program?
Well, what I like to let you know is that the same thing Ms. Luce said to me. She said a lot of people may come, but they won't complete the process. And if they call you and they ask for help for you, my suggestion is you come. They're very resourceful. Spent many years homeless and not knowing where my next meal comes from. To search and those are no longer my worries today. I really, really feel blessed. I really know I'm blessed. So if you need help, I suggest you come out, speak to SOAR, speak to Search, and they have the resources that will help you.
So that's how we work the program here at Search.
Thank you. It sounds like you both made a friend, hope, health, and home, and a friend. That's wonderful. Thank you, Frank, for sharing your story and working along with LaTanya
Yes, ma'am.
there at Search.
Yes,
Now we're going to we are going to move into like a general Q&A session. So if you want to stay on camera, we're going to have the other panelists also come on and put up their camera. We do have time for Q&A. You can put your question in the Q&A box. We've already answered, let's see, about 30 questions, and I want to give Hope a chance to talk about her last slide when she had some audio issues, because I know she was really talking about some really helpful information. Do you want to talk a little bit, Hope, about your last slide?
Yeah, absolutely. Hopefully folks can hear me a little bit better now. I'm so sorry my internet cut out, but thanks for your flexibility and grace. I just wanted to wrap up my presentation by very quickly sharing how the Texas Balance of State Continuum of Care supports SOAR work on an ongoing basis. It looks like we are navigating back to that slide. So as a COC, we host an annual SOAR orientation for our general membership. We do this virtually so that we can get the most folks in the room at any given time. This is really a place where folks can come and get a really high level overview about what the SOAR process looks like and the benefits that it can have on an individual and a program and a community. Additionally, we offer a number of other strategies to support SOAR work in programs and communities throughout our region. And I'll preface all of this by saying that, in short, we tailor our approach based on the unique needs of a community and unique needs of the program, given the specific resources and assets and challenges that that community is facing. So we support throughout the lifetime of the process, from the early planning stages to what implementation might look like and process development, and ongoing implementation to foster continuous success and oversight of the process. Additionally, we work with communities to explore what it might look like to integrate SOAR into the project design of a funding opportunity that a provider is considering applying for or exploring. And that includes things like what their salary and compensation should be, what an anticipated caseload might be for SOAR claims at any given time, and what the process might look like to connect folks who need SOAR in connection to a housing program to begin the SOAR process alongside the housing process. We also offer information and referrals for both clients that are seeking SOAR services, but also providers that are seeking SOAR services on behalf of a client. So we use information that's available based on who's been trained in the Texas Balance of State Continuum of Care to be able to provide those tailored referrals. And oftentimes there may not be a SOAR worker that's trained in their area. And in those cases, we explore what other resources might exist that we can refer that person to. And then we offer one-on-one technical assistance for programs, agencies, and communities that are looking to implement SOAR or who have already implemented SOAR to increase the success of their project. And then lastly, we offer SOAR community kickoffs. So if a community or a program is implementing SOAR for the first time, we're able to travel to that community and host a kickoff party to really build the buy-in around SOAR locally, and get that high level of engagement right from the start. It's a lot of information sharing about the benefits of SOAR and what it might look like in a specific community to really start the project off with success. And with that, I will end by sharing my contact information. I'm happy to connect with folks who are wanting to learn more about how we've integrated SOAR into a competition. And with that, I will pass it back over to Pam.
Well, thanks. I'm glad you're able to describe that slide. Really important, very practical. And we're getting a lot of questions about Omar, about Houston. And, your assessment tool. So folks want to know, like, what tool do you use for your assessment to screen in or screen out folks for either SOAR or the workforce, development piece to it? Do you want to talk about your screening tool? And also, how do folks make a referral? Is it through your coordinated entry before they can get to a search type program? So Omar, do you want to kind of chime in on first your assessment tool, your screening tool? And you would just have to unmute yourself. Do we need to unmute the panelists? If not, we can come back to Omar, because we did have questions generally about COC funding. And I know we have Texas and Missouri on this call, so COCs may be a little bit different, but do you want to just address how the community gets together through your COCs to determine a funding plan? As we know, Hope's program decided, hey, we're going to fund SOAR dedicated specialists. We're going to attach that. So do you want to talk a little bit about funding? I don't know who wants to go first.
Just in terms of funding in general, Pam?
Funding in general. How does the COC determine who gets the funds and for what purposes? We know indirectly towards SOAR can be an included intervention because it increases income. Just one of the priorities. Yeah, just maybe in general.
I can start. So I would say that I think every continuum of care probably has a little bit different approach to what their priorities are, and what they, even like what housing interventions that might be prioritized in a given year. And I think, I can't speak to what every COC is doing, but I can speak to what our COC is doing. So again, our policies and priorities were developed in response to direct feedback from our membership. So we really used the voices of our membership to shape what our funding priorities are. And I think that has been really successful in gaining buy-in around the process. And is the process that makes the most sense for a COC of our size, given that we're based in Austin, Texas, but our providers are working in communities all over the state that may have very different needs and very different belief systems about what it means to address homelessness in their community. So unfortunately, I don't think there's any like easy answer, in that it just really depends on like what the needs and priorities are of a COC. And oftentimes that's driven by membership and translated to priorities identified at the governance level. So I really encourage COCs to consider how they're uplifting the voices of their members and shaping what their funding requirements are, and how they're engaging folks with lived experience to shape what their priorities are, because that process has worked well for us as a COC. And I think the fact that our priorities were developed collaboratively has helped kind of mitigate any kind of concerns that have come out about the priorities that are put forward. Like, they're not things that we in Austin sat down and identified and said, these are the 10 things that all providers should be doing. We're really intentional about soliciting feedback from members and then creating a process around what members were telling us. So I think, again, like every COC has a little bit different approach and a little bit different priorities. I'm not sure if anyone else has anything to add.
I'll just kind of piggyback off of Hope's comments, because Hope, I think you hit on really a key point, because I think oftentimes communities recognize that there's a need for a service like SOAR, and have a lot of questions about funding. And I think I kind of saw a lot of questions about funding and things like that and developing processes in the comments. And I think you hit on a key point, Hope, though, when you said that oftentimes when different entities, whether it's a COC or some other type of entity that organizes funding, oftentimes how they develop those priorities is like from the voices of the people actually on the ground doing the work, in terms of knowing what's important, in terms of knowing, hey, yes, we should dedicate funding to this resource or to this service or carve this out or make this part of our project. So I think for a lot of the people that are kind of asking questions about funding or about getting started or things like that, I really encourage you all to kind of make your voices known that this is a service your clients need. Make that known to your COCs, to your local mental health authorities, right? When you have those opportunities, I think you really kind of hit on a key point there, Hope.
Thanks. And Samitra, do you want to, tell folks how do they find out where their local COC is, how to connect to a person and say, hey, I want to join the COC. Maybe that their agency is already a member. How can folks find out how to get in contact with their local COC?
Yeah, no, that's actually a great question, Pam. So I definitely recommend going to the HUD Exchange website, and you can just click on contact a local COC. You can put in your state. They will list all the COCs within that state. And again, every state is kind of in terms of like positioned, I guess like grouped differently in terms of their COCs. Some it's just like one covering the whole state. Some of them, large states like Texas, like Hope was mentioning, right? There are a number of COCs. So if you really just go to that HUD website, type in your state, it will list out the different COCs in your state, as well as the contact information. And also too, if you go to their websites, I definitely recommend going and checking out. They will often have information in terms of membership. And how to go about doing so and the benefits of that. So I definitely encourage you all to check that out.
And we do provide those links in our resources that you'll see at the end of the slides as well. So you'll be able to click that on and get right to your state and find out your local COC. Some folks are finding out, how can I, take the online course or find out who my SOAR TA Center liaison is, like Samitra. Well, you can go to the SOAR website, click on your state, and then you'll see the contacts for your state lead, if your state has a state lead, or some local leads who will know about their COCs, hopefully. And if not, your SOAR TA Center liaison, like myself and Samitra, and you can reach out to them and they can provide more information about what's going on locally, if you're not aware. So we got a question from an individual, and this is quite common because as Samitra said in the beginning, that SOAR is to be utilized for individuals who are homeless or at risk of homelessness. So the question is, when people get into permanent supportive housing or a rapid rehousing program through their COCs, are they still eligible to receive SOAR services? I have heard before that SOAR is intended to support people currently experiencing homelessness. But as I said, it's for individuals who are at risk. And so that would include individuals in a permanent supportive housing or rapid rehousing or transitional housing type of program, because if they should lose that funding for that program or the voucher, for that housing, then they would be at risk of homelessness. So I just wanted to clarify that for folks who aren't as familiar with SOAR, that this is intended for folks who are at risk of homelessness. Samitra or anyone want to talk a little bit about that, when you determine who may be eligible for SOAR services?
Yeah, I mean, just kind of piggybacking off of the definition you just gave, Pam. So, just letting it be known, like SOAR follows the HERTH Act definition of homelessness. So that includes those that follow the more traditional definition of homelessness, like living outside or in a shelter or in a car. But it also includes anyone who might be at imminent risk of homelessness. So someone living doubled up, someone couch surfing, someone in a transitional setting such as a jail or a hospital, right? And it includes someone who might be in permanent supportive housing or rapid rehousing or a HUD VASH program, where if that funding was to get pulled tomorrow, would they still be able to afford that place? And if the answer is no, then they're at risk. So that is the general kind of definitions of homelessness that SOAR follows. With that said, again, SOAR, in terms of like how it's implemented in local, communities, it's going to look differently depending on the community. And so you would want to connect with your local contacts to know what specifically the eligibility criteria is, to have access to the SOAR services in that community. But generally speaking, yes, individuals in permanent supportive housing projects are included in at-risk categories.
Thanks, Mitra. So we have just a couple minutes left. I want to just throw it to you all to see if you have any tips for how to really increase some of those opportunities to bring SOAR to your COCs. What kind of takeaway do you have for doing that? Like a tip or a reason why SOAR is a good intervention to include, within your COC? Let's see. Latanya, do you have anything you want to say why SOAR would be a good addition to any COC? Tanya, Frank?
Search. Well, here at Search, the SOAR program is going through some changes, and we have been very successful thus far, helping a lot of our clients obtain income, helping them gain financial stability. I think it would be, it's not only a great part, it's a needed part. It should be a mandatory part of a program to help the clients in the community, especially the population that we deal with.
Well, thanks for that. And I think this webinar really will go a long way in having those initial discussions and conversations about SOAR and how to include SOAR in your local COC. Make it an agenda item on a monthly or quarterly meeting. Have your TA center liaison or your SOAR leads come and do those presentations. We'd be really happy to talk to you more about how you can do that. So we've run out of time. I just want to thank all of our panelists for sharing your expertise on your COCs and your SOAR integration and all of your plans. Well, maybe, I don't know if we're putting up the slides again, but you will be directed at the end of this webinar when you sign off to an evaluation. That evaluation will also allow you to pose a question that we'll be able to address after the webinar. But also that evaluation, remember, comes with a certificate. So that may be something useful for you to have the certificate that you joined our webinar. So again, I just want to thank everyone for joining us today. And please connect with your SOAR leads, liaisons here. We'd love to help you really begin the conversations with your COCs. And thanks again for joining us today. Take care.